The entire trauma room burst out laughing when the new nurse stepped forward and said she could save the dying SEAL commander's arm. The surgeons called her delusional. The residents told her to get out of the way. The charge nurse pointed at the door and said those exact words, "You don't belong here." She had been at Mercer General for 6 weeks. Nobody knew her name, nobody asked. But when the wounded commander opened his eyes through the blood and the pain and the noise of that room, he found her face across the crowd. And he raised his hand. A full military salute. The room went silent so fast it felt like the air had been pulled out. If this story has you hooked already, follow my channel so you don't miss what happens next. Hit that like button and drop a comment telling me what city you're watching from. I want to see how far this story travels. Now let's get into it. The call came in at 11:47 p.m. Dispatch flagged it as a priority trauma. Male, late 30s, multi-system injuries, inbound via military transport. The kind of alert that made night shift residents stand up straighter and charge nurses start barking orders before the doors even opened. At Mercer General Hospital in Calverton, Virginia. The emergency trauma unit was already a controlled storm by the time the gurney hit the floor. 3 surgeons, 2 residents, a full nursing team. Everyone moving, everyone talking, nobody listening to anyone else. Nurse Lena Vasquez stood at the periphery of the room, where she had learned in 6 weeks that she was expected to stay. She was 31 years old, brown-haired, with the kind of face that people looked at and immediately decided wasn't worth remembering. She wasn't loud. She didn't push. When she arrived each shift, she changed her shoes in the locker room, tied her hair back, and went to work. Drawing blood, logging vitals, restocking supply carts, doing the 100 invisible things that kept a trauma floor functioning while the people with credentials got the credit. She had joined Mercer General in early October, transferred from a rural county clinic 2 states away, no referrals, no connections, no one waiting to welcome her. The hiring manager had noted her paperwork was unusual, employment gaps, a prior address that didn't match any hospital system, but her certifications were clean and the unit was understaffed, so they gave her a badge and a locker and told her where to find the coffee. That was the full extent of her orientation. The senior nurses tolerated her. The residents ignored her. Dr. Marcus Holt, the department's lead trauma surgeon, had spoken to her exactly twice in 6 weeks. Once to ask if she'd ordered the wrong size chest tubes, and once to tell her that if she couldn't keep up with his pace, she should consider a quieter unit. Lena had nodded both times and said nothing. She was good at saying nothing. What she was not good at, what she could not seem to stop doing no matter how hard she tried, was noticing things. Details. The particular way a patient held a limb, the quality of skin color around a wound, the sound of breathing when something deeper was wrong. It was an instinct she couldn't turn off. And in a hospital like this, where nobody asked the new nurse's opinion, it mostly just made her quietly miserable. Tonight, it was going to make her something else entirely. The gurney came through the trauma bay doors at 11:53, and even in the chaos, Lena saw the man on it clearly. He was large, broad through the chest, heavily muscled in the way that spoke of years of physical discipline rather than vanity. His left arm was wrapped in a field dressing that was already soaked through, the kind of wrap you did when you had nothing better and time was running out. His face was pale, jaw clenched, eyes moving with the specific alertness of someone trained to stay conscious even when everything in the body was pushing toward shutdown. The team converged on him immediately. Commander Damon Reeves, the military medic accompanying the gurney, said, keeping pace alongside it. 38. Crush injury to the left arm, sustained during a classified field operation. We applied the tourniquet at 22 minutes. Distal pulse was weak on scene. Undetectable now. Dr. Holt was already pulling on gloves. CT or straight to OR? His pressure's been dropping, the medic said. OR, Holt decided, not asking anyone. We're looking at vascular compromise. Prep for amputation below the elbow. Lena's head came up. She was standing near the supply wall holding a tray she'd been asked to bring in. She looked at the arm, the field dressing, the color of the skin above and below the tourniquet. She looked at the patient's face. She did not say anything, not yet. Get that imaging anyway, Dr. Kayla Okafor said, the second trauma surgeon on call, moving to the opposite side of the gurney. I want to see what we're working with before we make a call. I've made the call, Holt said. Okafor glanced at him. Marcus, 22 minutes on a tourniquet with no distal pulse. The limb is compromised. The dressing is wet, not the arm, Okafor said carefully. Same outcome. It wasn't, and Lena knew it. She also knew that Dr. Holt had 17 years of experience, 3 published papers on vascular trauma, and absolutely no patience for being questioned by anyone who was not at his level. She knew which nurses had tried to speak up before her and what it had cost them. She set the tray down quietly and moved 2 steps to the left to get a better angle on the arm. The resident nearest her, a second-year named Bryce Calloway, noticed her moving and frowned. You got somewhere to be? Just getting out of the way, Lena said. Good. He turned back to the team. She looked at the arm again. The skin above the tourniquet was dusky but not mottled. The tourniquet itself had been applied mid-forearm, which was, she cataloged it without drama, not optimal positioning for a crush injury of this type. The field dressing covered an area that extended above the tourniquet line, which meant the original injury was higher than what was visible. The visible swelling was significant but not uniform. There was a pattern to it, a specific kind of pressure distribution that she recognized from a context that had nothing to do with the hospital. Dr. Holt was giving OR prep instructions. The team was moving. Excuse me. Nobody turned around. Excuse me. Calloway turned. Can you go find someone a warm blanket or something? We're kind of busy. The limb isn't dead, Lena said. Complete silence. Not the respectful kind. The kind where people stop and stare because something unexpected and slightly absurd has happened. Holt turned slowly. He was 53, silver-haired, with the kind of face that had stopped being apologetic about its expression sometime in his 40s. He looked at Lena the way people look at a car alarm going off in a parking lot, annoyed, dismissive, already moving on mentally. I'm sorry, who are you? Lena Vasquez, I'm a floor nurse. A floor nurse, he repeated with a specific inflection that turned the phrase into a verdict. Meaning you are not a trauma surgeon, meaning you have not assessed this patient, meaning your opinion on the viability of his limb is, he paused, choosing the word with care, not something I need right now. The tourniquet placement is wrong, she said. The compression is creating the appearance of vascular compromise. The blood flow isn't gone. It's blocked. The room had gone very quiet in a way that was not comfortable for anyone. Is that a fact? Holt said. The swelling pattern is compartmental, not systemic. If you decompress the right area, if I decompress incorrectly on a compromised limb, I trigger a bleed that kills him in this room, Holt said, which is why we have surgeons making these decisions and not nursing staff. Someone near the back of the room stifled a laugh. Calloway had his arms crossed, watching her with the particular expression of someone enjoying a situation they did not need to involve themselves in. Okafor was looking at Lena differently, not with agreement, but with a kind of careful, evaluating attention that was different from everyone else in the room. Get the imaging first, Okafor said again quietly. 30 seconds. We don't have 30 seconds. We might, Okafor said. If she's right. Holt looked between them. He had the expression of a man who was very used to winning arguments quickly and was recalibrating to find himself still in one. She's a floor nurse, he said again, as if that settled it. I know what she is, Okafor said. I'm asking about the imaging. The patient moved. It was subtle, but just a shift of weight, a tightening of the jaw. But Lena saw it and moved toward the gurney instinctively, reaching for the blood pressure cuff, running a quick visual check of his coloring. The commander's eyes opened. They were dark brown, and even through the pain and the haze of whatever medication the field medic had administered, they were absolutely focused. He looked at the ceiling, at Holt, at Okafor, at Calloway. Then he found Lena, and something changed in his face. It wasn't quite recognition. It was something further forward than recognition, more like the particular relief of finding something you had stopped believing existed. His right hand came up, not reaching, not grasping, raised, deliberately, with the last controlled energy he had in that moment, fingers straight, wrist aligned, a military salute, clean and precise, even from a hospital gurney. "Chief Vasquez," he said, voice rough but certain. "Didn't think I'd see you here." The room stopped. Lena's expression didn't change. That was the thing people would remember afterward, that she didn't look surprised, didn't look relieved, didn't look anything at all. She just looked at him with the same calm, measuring attention she'd given the injured arm. "Commander Reeves," she said quietly, "keep still." Holt was staring. Calloway was staring. Even the OR prep nurse had stopped moving. "What did he call you?" Holt asked. Lena didn't answer him. She was watching Reeves's breathing, her fingers finding his wrist, counting. "Chief Vasquez," Reeves said again, more quietly now, the salute lowering as his strength faltered. "I was in bad country. Didn't think I was going to—" "You're not done," she said. "Stay with me." "What is happening right now?" Calloway said, not to anyone in particular. The military medic who had come in with the gurney was standing near the door, and he was looking at Lena with an expression that had shifted completely from when he'd walked in. He was younger than her by at least 6 years. His posture had changed. "How long has he been losing sensation in the hand?" Lena asked him, keeping her voice even. The medic straightened without thinking about it. He reported tingling at about the 8-minute mark, then nothing at 15. "And the tourniquet was applied?" "Approximately here." The medic indicated a point that confirmed exactly what she'd suspected. "Field conditions. We did what we could." "I know you did," she said. She looked at Reeves. "On a scale of 1 to 10. 7, he said immediately. "He said 4 when we loaded him," the medic offered. "He lied," Lena said without heat. "He always undersells it by 3 points. She glanced at Reeves, something briefly human crossing her face. "You haven't changed." Holt stepped forward. "I don't know what's going on here or who this man thinks you are, but I need you to step back so we can—" "The compartment pressure is building," she said. "If you amputate below the current tourniquet line, you're removing a limb that will have full function in approximately 40 minutes. The vascular supply is intact. It's being compressed by a secondary hematoma that developed above the tourniquet, which is why you're not seeing distal pulse. The pressure is upstream." Holt stared at her. "That is," he started. "Verifiable in 30 seconds of imaging," Okafor said, with a finality that wasn't quite pointed but also wasn't polite. She looked at the OR prep nurse. "Get me the portable ultrasound. Now." "Dr. Okafor. Now, please." Holt's jaw tightened. He looked at Lena for a long moment, and what moved across his face was more complicated than anger. It was the particular expression of someone who has built a worldview around a specific ordering of things and felt that order shift under their feet. "If you're wrong," he said, "and we lose this limb because we wasted time—" "I'm not wrong," Lena said. Not defiantly, just as information. The portable ultrasound arrived. Okafor ran it herself, her expression focused and unreadable. The room watched. 60 seconds passed. Okafor moved the probe. Stopped. Adjusted. Her face changed. It was a small change, a controlled, professional kind of surprise, the kind that shows up as a slight stillness rather than an expression. She looked at the monitor, looked at Lena. "There's a hematoma," she said. "Superior to the tourniquet, significant compression." Nobody moved. "Vascular supply appears intact," Okafor continued. "The signal's weak but present." Holt looked at the monitor for a long time. The OR prep nurse had stopped moving entirely. Calloway had uncrossed his arms. "So what you're telling me," Holt said slowly, "is that this man's arm is savable," Okafor said. "If we decompress correctly and get him to the OR for the hematoma evacuation." The silence was different now. Not the comfortable silence of people about to agree with each other. Something rawer than that. The silence of a room that had been wronged together and hadn't processed it yet. Reeves turned his head slightly toward Lena. "You were always the first one to see it," he said, quiet enough that only she heard it. She checked his pulse again. "Don't talk. Save your strength." "The team still talks about you," he said anyway. "They said you disappeared." "I didn't disappear," she said. I just stopped wearing the uniform. Holt was pulling on a different set of gloves. Procedure gloves, not OR gloves. A decision had been made without being announced. We'll need OR3 prepped for hematoma evacuation and vascular decompression. He said it to the room, not to Lena, not to Okafor, not to anyone in particular. The voice of a man who had adjusted course and would not be discussing the adjustment. Calloway was looking at Lena differently now. Still not warmly, but differently. "You did a rotation in trauma surgery?" he asked, trying to make it casual. "No," Lena said. "Then where?" "I learned it somewhere else," she said. She picked up the tray she'd set down earlier and moved toward the supply wall, because the surgery prep was beginning and her part of this particular moment was over. She had said what she came to say. She had been heard, not by everyone, not without cost, but by the person who counted most when 30 seconds still remained on the clock. Behind her, the OR team was moving with new direction. Okafor was marking the decompression site. The field medic was relaying the updated information to someone on a secured line. The normal sounds of a trauma bay in motion had returned, but the texture of the room was different. Calloway was still watching her. She found the supply cart, began restocking it with the particular efficiency of someone who did it every night, muscle memory running the task while her mind ran somewhere quieter. She counted suture packets. She logged the inventory without looking at it. She moved down the line. At the OR doors, someone called for the patient to be moved. As the gurney passed her, Reeves turned his head and found her face one more time. He didn't salute again. He just looked at her, something in his expression that was older than gratitude and heavier than relief. She gave him a small nod. The doors swung shut, and then Dr. Marcus Holt was standing 3 feet away from her, and the supply cart was between them, and the hallway was suddenly very quiet. "Vasquez," he said. She looked up. "That man called you chief," Holt said. Not angry, not apologetic either, just working it out loud, in the way people do when something has shifted and they're still finding the shape of the new reality. "Military rank, chief warrant officer," she said. "Army." Holt was quiet for a moment. "Special operations?" he asked. She started to answer, and then the double doors at the far end of the hallway burst open and a second team came through. Not hospital staff, not medics, but 4 individuals in civilian clothes that fit in a specific way, moving in a specific formation, with the kind of coordinated efficiency that had nothing to do with hospital protocol. They stopped when they saw Lena. The one in front, dark-haired, mid-40s, moving like someone who had learned to catalog a room in under 2 seconds, locked on her face. Then he stopped, and he stood completely straight, and he saluted. The 3 behind him did the same, without a word, without a signal from each other, just the synchronized reaction of people responding to someone they recognized as something specific. Holt turned around slowly. The hallway felt like it had gotten smaller. "Who are they?" he asked. Lena didn't answer right away. She was looking at the man in front, the one who had saluted first, and for the first time since she'd walked into that trauma bay and been told to stay out of the way, something moved in her face that she hadn't planned on showing. Not pride, not vindication. Something more complicated than either of those things. "People I used to work with," she said quietly. Holt looked at her for a long moment, at the people in the hallway, at the OR doors where Reeves had just been taken through. He opened his mouth. Then he closed it. Because for the first time tonight, Dr. Marcus Holt did not have anything to say. And in that silence, Lena Vasquez, floor nurse, new girl, the woman nobody had thought to ask, turned back to her supply cart and kept working. Her hands were steady. They had always been steady. That was the thing about her that nobody here had understood yet. Her hands had been steady in places where unsteady hands cost lives. And not one person in this building, not Holt, not Calloway, not the charge nurse who scheduled her for the least desirable shifts, had the first idea what that actually meant. Outside the OR doors, One of the new arrivals broke formation and moved toward the nursing station, producing credentials that the night shift coordinator looked at for a long moment before picking up the phone. Whatever she said into it made the administrator on call show up 8 minutes later, still in his coat, still holding his car keys. He looked at the credentials. He looked at the hallway. He looked at Lena Vasquez, who was 3/4 done with her supply cart and had not looked up once. He said something quietly to the man with the credentials, and the man with the credentials said something back that made the administrator set down his car keys. The night was not over, not even close. The administrator's name was Gerald Fitch, and he was the kind of man who had built his entire professional identity around never being the last person in the room to understand what was happening. Tonight, he was the last person in the room. He stood in the hallway outside the trauma bay with his car keys still in his hand. He'd set them down, then picked them back up without noticing, looking at the credentials one of the new arrivals had placed on the nursing station counter. The credentials were in a leather folio, the kind that didn't come from any agency Fitch recognized on site, which was itself information. He had been managing hospital administration for 19 years. He recognized most agency credentials on site. These, he did not. "I need to understand the scope of what you're asking," Fitch said, keeping his voice at the register he used for board meetings. Measured, authoritative, slightly slower than natural speech. "You're saying this woman—" "We're not asking for anything," said the man who had saluted first. His name, according to the credentials, was Agent Terrence Bowl. He looked like someone who had once been in excellent physical condition and had stayed there through discipline rather than enthusiasm. "We're advising you of a situation. What you do with that is your business." The situation being that one of your nursing staff, Bowl said, has a background that is substantially more complex than whatever she put on her intake forms. Fitch looked down the hallway toward the supply cart where Lena Vasquez was still working, still moving with that particular unhurried efficiency, as if none of this was happening behind her. "She passed our credentialing process," he said. "Her certifications were real," Bowl said. "Everything she gave you was real. That's not the issue." "Then what is the issue?" Bowl glanced at his colleagues, a brief exchange that communicated something Fitch couldn't decode. "The issue," he said, "is that Commander Reeves requested her specifically, before transport. He was explicit about it. He requested a floor nurse. He requested Chief Warrant Officer Lena Vasquez," Bowl said. "The floor nurse part was apparently her own decision." Fitch looked at the credentials again. He looked at the OR doors. He thought about 17 different administrative problems that were assembling themselves in real time and decided, with the pragmatism of a man who had survived 4 hospital mergers, to deal with the most immediate one first. He put his car keys in his pocket. "Is she in any danger?" he asked. Bowl considered the question with what looked like genuine honesty. "Probably not here," he said. "Tonight." Which was not the answer Fitch had been hoping for, but it was at least a real one. Down the hall, Lena finished the supply cart, logged the completion on the handheld tablet, and turned around to find Calloway standing 6 feet away, watching her with his arms at his sides and an expression she hadn't seen on him before. Not contempt, not the bored tolerance he usually aimed in her direction. Something more uncertain than either of those. "Those people know you," he said. "Yes," she said. "From the Army?" "Among other things." Calloway was quiet for a moment. He was 28, she had estimated, the kind of smart that had always been validated quickly enough that he hadn't developed patience for the other kind. The kind of smart she'd worked alongside in a different context. People who were genuinely gifted and had been told so too often and too early. "The thing you said about the hematoma," he started. "The pressure pattern. I've never seen that called from presentation alone." "I know," she said. "I mean, I've read about it. The field triage literature on tourniquet compression. But reading about it and—" He stopped. Restarted. "How many times have you seen it?" She thought about it honestly. "Enough that I stopped counting." His jaw moved. "In what context?" She picked up the tablet, logged back into the system, and started entering the supply update. "Calloway," she said, without looking up, "you don't actually want the answer to that question." "I think I do." You think you do, she said. But what you want is a version of the answer that fits into a category you already have. And the actual answer doesn't do that. She finished the log entry. Go check on your patients. He stood there for another 3 seconds, working something out that she could see him working out, and then he turned and went back to the floor. She let out a breath she hadn't been aware of holding. The thing about Calloway was that he wasn't wrong to be curious. He was just asking the question 6 weeks too late and from a position that still assumed he was the one doing the evaluating. She had met versions of him before, bright, capable people who operated in hierarchies so defined that they didn't notice they were in them until the hierarchy inverted. It happened. She had been the cause of it happening, more times than she'd wanted to be. She did not enjoy this part. People seemed to expect that she would. The OR charge nurse appeared at the end of the hallway. Vasquez, Holt wants you in the gallery. Lena looked up. He wants me in the gallery. His words were actually... The charge nurse paused, seeming to choose among several options. He said he wanted the nurse who called the hematoma, where he could see her in case anything developed. I'm just passing the message. Lena clipped the tablet back to the cart. Tell him I'll be there in 5 minutes. She stopped at the locker room first, changed her gloves, washed her face at the sink, cold water, more of it than she needed. Looked at herself in the mirror the way she sometimes did. Not vanity, just a check, the way you'd check your gear before a movement. She looked tired. She looked fine. She looked like someone who had been doing a job nobody noticed for 6 weeks and had run out of room to stay invisible. She had known it was coming. That was the honest version. When she'd seen Reeves on that gurney, she had known that the careful, ordinary life she'd been constructing in this hospital, the deliberate smallness of it, the supply carts and the early shifts, and the name badge that said only Lena, had probably just ended. She just hadn't known how fast. She went to the gallery. Holt was at the surgical table below, working with the focused economy of someone who was genuinely excellent at what he did. Lena had never doubted that. His arrogance and his skill were not the same thing, and the arrogance was real, but so was the skill, and she had spent enough time in enough difficult rooms to know the difference between someone who was wrong about everything and someone who was wrong about one specific thing. Holt was wrong about one specific thing. He was not wrong about surgery. She watched him work. The hematoma evacuation was precise, the vascular decompression careful, the decision sequence logical and well executed. Okafor was across from him, equally focused, and the two of them moved around each other with the efficiency of people who had worked in the same space long enough to know each other's habits without necessarily liking each other. From the gallery, she could see Reeves's hand. 20 minutes into the procedure, the fingers moved. It was reflex, yet involuntary, a response to the decompression, but it meant exactly what she'd said it would mean. The limb was viable. The blood flow was returning. The decision that had been made in the trauma bay, in the teeth of every objection, was the right one. She was aware that she should feel something cleaner than what she actually felt, which was a complicated mixture of relief and exhaustion and the particular frustration of being right in a way that cost more than it should have. She sat in the gallery for 40 minutes, watching, and nobody else came in. When she came back down, Bull was waiting for her outside the OR corridor. He's gonna make it, she said, before he could speak. I know, Bull said. We've been monitoring. Is there something you need from me tonight? He looked at her steadily. Commander Reeves is going to want to debrief you when he's out of recovery. I'm not debriefable, she said. I'm a nurse. You were in his unit for 3 years, Bull said, before Kestrel. The word landed like a stone in still water. She watched the ripples for a moment before she decided how to respond. That's a long time ago, she said. Reeves doesn't think so. Reeves almost lost his arm tonight, she said. He's running on adrenaline and painkillers. He'll think differently in the morning. Maybe, Bull said. Or maybe he specifically routed his transport to this hospital because he knew you were here. He paused. The unit tracks its people, Vasquez, even the ones who ask not to be tracked. She absorbed that. It was not entirely a surprise, but it was not comfortable either. The knowledge that the quiet she'd built around herself had always been slightly permeable, that somewhere in a system she'd walked away from, a file with her name on it had continued to update. Why? She asked. Because people with your background don't stop being useful just because they want to, Bowles said, without apology. And because 3 of the people you served with have requested your location in the last 18 months. Who? He considered. That I can't tell you tonight. She looked at him for a long moment. He was not unkind. That was the thing she noticed about him. He was direct and he was serving an agenda she didn't fully know, but he wasn't enjoying any of this. There's going to be paperwork, she said finally. There's going to be a considerable amount of paperwork, he agreed, and possibly some conversations with people above my level. And Commander Reeves is going to be in that recovery room for at least 5 days, which means, I know what it means, she said. She walked back toward the nursing station, and Bowles did not follow her. The floor was quieter now, the particular quiet of a trauma unit in the hour before dawn. Not peaceful exactly, but settled. The controlled chaos of the earlier hours replaced by the steadier rhythm of monitoring and waiting. 2 of the night nurses were at the station. One of them looked up when Lena came back and then looked away, and then looked back. Vasquez, she said. Lena stopped. The nurse's name was Sandra Park, 40-something, experienced, the kind of person who had seen enough that very little rattled her. What happened tonight? I just want to say that was... You don't have to say anything, Lena said. I know I don't. I'm saying it anyway. Park held her gaze. The arm, the call you made. That was... I've been working trauma for 12 years and I've never seen someone read a presentation like that. Lena felt something shift uncomfortably in her chest. This was, in some ways, harder than the contempt had been. The contempt she knew how to handle. I had good training, she said. Park nodded, not pushing it. She was smarter than that. She passed Lena the overnight log without being asked, and Lena took it, and they moved on, and the moment dissolved back into the ordinary machinery of the floor. At 3:15 a.m., Holt came out of the OR. He walked toward the nursing station and stopped in front of Lena, and for a moment he just stood there, still in his surgical cap, looking at her with the expression of a man who had spent 2 hours thinking about something and had not reached a conclusion that made him comfortable. The arm is going to be fine, he said. I know, she said. Full vascular decompression. He'll have some nerve sensitivity issues for a few weeks, but function should return to... He stopped, started again. You were right, about the mechanism, about the diagnosis. She waited. I've been in trauma surgery for 17 years, he said. I've done 3 fellowships. I have over 400 peer-reviewed citations. He said it without pride, more like inventory, like someone checking what they had on hand. And you read that presentation in 45 seconds from 8 feet away. I wasn't 8 feet away, she said. I was closer to 6. He stared at her. She wasn't sure why she'd said it. It wasn't useful. It didn't soften anything. It was just accurate. Where did you get that? He asked. That specific knowledge. She considered several answers and chose the honest one. From situations where the alternative to knowing it was watching someone die. His jaw moved. Combat. Among other things. He was quiet for a long time. Around them, the night shift moved through its routine, vital checks, chart updates, the soft beeping of monitors from the patient bays, the normal sounds of a hospital floor that had been briefly upended and was now reassembling itself. I'm going to need to report this to the board, Holt said. Your involvement in the case, the diagnosis, He seemed to be weighing the word he wanted. The circumstances. I know, Lena said. I want you to understand that that report is going to include an accurate account of what happened. I'm not going to... He stopped. I'm going to be accurate. She looked at him steadily. I expect you to be. He nodded once, shortly, and turned and walked toward the physician's lounge. And she watched him go, and there was nothing triumphant in watching him go, which she thought was probably appropriate. What happened next, she had not anticipated. At 4 a.m., her phone buzzed. Hospital internal system. Message from the night administrator. She read it again, set the phone face down on the counter. Sandra Park noticed. Everything okay? I've been asked to attend a meeting at 7 a.m., Lena said, with the chief of medicine and the hospital's legal team. Park's expression shifted. Legal. Standard procedure, Lena said, with a certainty she did not entirely feel. When a non-attending makes a diagnostic call that affects a surgical decision, there's a review process. She picked up the phone again, looked at the message. It's a review process. What the message didn't say, but what she understood from the list of attendees copied on it, was that it was not only a review process. One of the names on that list was not hospital administration. One of the names she recognized from a different context, from a time when she had worn a different kind of badge. She finished her shift at 6 a.m. She changed her shoes. She washed her hands. She sat in the locker room for 4 minutes doing nothing, which was 4 minutes more than she normally allowed herself. Then she went upstairs. The conference room on the 4th floor was the kind of room that communicated consequence. Large table, good chairs, a view of the parking structure that was still lit against the early morning gray. 4 people were already there when she arrived. The chief of medicine, a woman named Dr. Patricia Suen, who Lena had met once at orientation. The hospital's legal counsel, a compact man in a gray suit who had the energy of someone who had been awake since 5. A woman Lena didn't recognize in a blue blazer, and Agent Bowl, who was holding a paper cup of coffee and looked like he hadn't slept. Nobody looked like they'd slept. Nurse Vasquez, Suen said, "Thank you for coming up. Please sit down." Lena sat. She did not say thank you. She put her hands on the table in front of her. "We'll be direct," Suen said. "Last night's events have triggered a review of your background and credentials, which is standard procedure when—" "I understand the procedure," Lena said. Suen paused. "Right. Then you understand that there are some discrepancies in your employment history that we need to address." "Define discrepancies," Lena said. The legal counsel slid a folder across the table. Inside it was a printout of her personnel file with 3 sections highlighted in yellow. She looked at it without touching it. "You listed prior employment as a rural clinic nurse practitioner," the counsel said. "From 2019 to 2023. That's correct? And before that?" "That's where it gets complicated," Lena said. "Chief Warrant Officer," Bull said from his end of the table, setting down his coffee. "Army Special Operations Medical Detachment. 2 deployments, 1 classified assignment. And then," he opened his own folder, "an 18-month period of assignment that is not in her accessible file because it is in a file that most of the people in this room do not have clearance to access." The room was very quiet. The woman in the blue blazer, who had not spoken yet, said, "We don't need the specifics." "Good," Bull said. "Because I wasn't going to give them." Suen looked at Lena. "Why didn't you disclose your military background in your intake forms?" It was a fair question. Lena had a fair answer. "I disclosed what I was legally permitted to disclose. Some portions of my service record are protected under federal statute. I provided all documentation I was authorized to provide. That documentation showed a 6-year gap in your nursing employment history," the counsel said. "Yes," she said. "Which we're supposed to have asked about." "Yes," she said again. "You're supposed to have asked about it." The counsel's expression said that he was aware of this particular failure and was not enjoying it. "Here's where we are," Suen said. She had the tone of someone trying to contain something large in a professional manner. "Last night, a member of our nursing staff made a diagnostic determination that directly influenced a surgical decision in this department. That diagnostic determination was correct. The patient's limb was saved." She paused. "Dr. Holt has already submitted his incident report, and I want to be honest with you. His account is accurate, and it is favorable to you, and he clearly found that uncomfortable." Something moved in Lena's face that she allowed briefly before settling back to neutral. "The board is going to have opinions about the procedural irregularities," Suen continued. "A nurse making a surgical call without attending supervision, the process by which that call was, or was not, appropriately escalated in the moment." She folded her hands. "I want to be clear that the review is about process, not outcome. The outcome was correct." "I know what the review is about," Lena said. "Then you also know," Suen said carefully, "that there are individuals above my level who have contacted the hospital this morning expressing an interest in the outcome of this review." Lena looked at Boal. Boal looked at his coffee cup. "How many individuals?" Lena said. "More than I expected by 7 a.m. Suen said. The woman in the blue blazer shifted in her chair, not impatiently, more like someone repositioning before a longer conversation than anticipated. Ms. Vasquez, she said, and her voice was different from Suen's, less institutional, more direct. My name is Ferris. I work with a federal coordination office that interfaces with military medical programs. I'm here in an informal capacity. She paused on the word informal in a way that made it clear it was load-bearing. Commander Reeves is in recovery and asking for you. He's awake? Lena asked. He's been awake for 40 minutes. He's coherent, mostly. He's asking questions we can't answer and declining sedation in a way that is creating challenges for the surgical team. Lena pressed her fingers to the bridge of her nose briefly. That sounds like him. They said he pulled out his IV line once already. That also sounds like him. We were hoping you might be able to, talk him down, Lena said. We were going to say assist with patient cooperation, Ferris said. I'll go, Lena said. She pushed her chair back. The review, Suen started. Schedule it, Lena said. I'll be there, whatever time works. She stood up. But right now there is a man in your recovery unit who is going to do something medically inadvisable if someone who knows him doesn't go talk to him, and the paperwork for that is going to be considerably more complicated than the paperwork for last night. Nobody argued with her. She was already at the door when Ferris said, Vasquez. She stopped. The people who've been calling this morning, Ferris said, they're not all from the same office. Lena's hand was on the doorframe. She held that for a moment. How many different offices? She asked. Ferris hesitated in a way that a federal coordinator with a title like hers should not have hesitated. That, she said, is what we're trying to figure out. Lena let that land, let it settle into the category of things she would need to think about later, when she had more information and less of this particular morning pressing in on all sides. She went down to recovery. Reeves was awake, propped at an angle the recovery nurses had probably not authorized, his left arm immobilized and bandaged from mid-forearm to above the elbow, his color better than it had been on the gurney, but still carrying the gray undertone of someone who had lost more blood than was ideal. He was looking at the ceiling when she came in. He turned his head when he heard her footsteps. There she is, he said. Don't move, she said. I'm not moving. You pulled out your IV. It was in the wrong position, he said. It was bothering me. It was keeping fluids in your body. I'm adequately hydrated, he said. She came to the side of the bed and looked at the bandaging, the monitoring leads, the replacement IV that someone had clearly just put back in. His hand was visible below the edge of the dressing. She looked at his fingers. He followed her gaze. They moved, he said. I know. I was in the gallery. He was quiet for a moment. You called it from presentation. Yes. From the trauma bay floor. He looked at her with an expression she recognized from a different life. The specific look of someone who had just watched another person do something that recalibrated their sense of what was possible. She'd seen it on his face before. It didn't make her more comfortable now than it had then. Damon, she said, because his name was easier than rank right now, and they both knew it. What are you doing here? I was injured, he said. You were injured at a location that had other hospitals closer. You were conscious enough to make a call about where to route the transport. So I'm asking again. I needed someone I trusted, he said. Flat and direct, the way he'd always been when he wasn't performing anything for anyone. There aren't many of those left. She sat down in the chair beside the bed. Not gently, just sat. The way you sit when you're tired and you're going to be there for a while. Bull said 3 people have requested my location in the last 18 months, she said. His expression shifted. What else did Bull tell you? That he couldn't tell me who. Reeves looked at the ceiling again. Outside the recovery room window, the morning was gray and getting lighter, the parking structure outside taking shape in the early dawn. There's a situation, he said. There's always a situation, she said. This one. He stopped. His jaw tightened in the way it did when he was choosing words with more care than usual. This one has your name on it, not because anyone put it there, because of what you did. Before. The classification that doesn't show up in your file. Kestrel, she said. Kestrel, he confirmed. She had not said that word out loud in 2 years. It sat in the recovery room like something physical. "Damon," she said carefully, "I left that behind." "I know you think you did," he said. "I didn't think I did. I did the work. I filed the paperwork. I transitioned out. It was done." He turned his head and looked at her, and his expression was not unkind, but it was the expression of someone who was about to say something that was going to be hard to hear regardless of how it was delivered. "There's a file," he said, "that was supposed to be sealed. 3 years ago, when you transitioned out, that file was supposed to be classified and closed." He paused. "It wasn't closed." The recovery room was very quiet. "What does that mean?" she said. "It means that certain people, not in our chain, not anyone you want having this, have been looking at what's in it." He held her gaze. "And what's in it, Lena, is everything." The morning light was coming through the window now, pale and flat, and Lena Vasquez sat in the chair beside the bed of the man she'd once pulled out of a burning vehicle on a road that didn't exist on any map, and she felt the careful, ordinary life she had built, the supply carts, the early shifts, the name badge that said only Lena, come fully apart in the space of a single sentence. "How long have you known?" she asked. "Long enough," he said, "that I made sure I was transported to a hospital where you'd be there when I woke up." She looked at him. Outside the door of the recovery room, she could hear the floor, monitors, footsteps, the ordinary sounds of a hospital morning beginning. She could hear 2 voices she didn't recognize moving past the door and continuing down the hall. She could hear, or thought she could hear, the specific quiet of something that had not yet arrived but was coming. "How much time do we have?" she asked. Reeves shifted, winced, settled. "Less than I'd like," he said. "More than you think." It wasn't the answer she wanted. It was probably the true one. She gave him 20 minutes. That was the deal she made with herself sitting in that chair. 20 minutes to get the shape of what he knew, then she would go back upstairs and sit in that conference room and do the thing she had always done when situations deteriorated past a certain point, which was make a decision and live with it. "Tell me about the file," she said. Reeves shifted against the pillow, working himself more upright with the careful economy of someone managing pain they weren't going to mention. "You know what's in it. I know what I did. I don't know what's documented." "Everything," he said again. "Kestrel ran for 14 months. You were the primary medical operator for 11 of those. Every extraction, every field assessment, he paused. "Every decision you made in the field. It's documented. Not in a way that protects you, in a way that protects the program." She understood the distinction immediately, the way she understood most things that were going to cause problems, fast and without the comfort of uncertainty. Meaning, if the program needed cover, the documentation could be read as me acting outside authority. Meaning the documentation was written to be read that way if necessary, Reeves said. It was a protection clause, standard for black programs. You knew about it. "I knew about it," she said. "I also knew it would never be needed because the program was classified and closed. It was supposed to be." "Damon," she kept her voice level. "Who has the file?" He looked at her for a moment, and in that moment she could see him calculating. Not whether to tell her, but how much to tell her in a setting that was not secure, with monitoring equipment in the room and a door that didn't lock, and 3 federal contacts somewhere on the floor above them. "There's a man named Garrett Pruitt," he said, "civilian contractor. He ran the logistics side of Kestrel for the last 4 months of the program. When it closed, he was supposed to transfer all documentation to the classified archive. And he didn't. He transferred most of it. What he kept was specific." Reeves's jaw tightened. "Personnel files, medical decision logs, yours in particular." "Why mine?" "Because yours are the ones that could create the most liability if the program ever became public," he said. "You made calls in the field that saved lives and also, in a certain light, read in a certain way, could be characterized as unauthorized medical experimentation. Unapproved protocols, procedures outside your designated scope." He held her gaze. "That's not what they were. You know that. I know that. But Pruitt has the documentation and he doesn't care what they were. He cares what they can be made to look like." The recovery room felt smaller than it had 60 seconds ago. "What does he want?" she said. That's the part I don't have yet, Reeves said. What I know is that he's been in contact with two people in the past month. One is a congressional staffer on the Defense Oversight Committee, and one is a journalist who has been trying to break a story about covert military medical programs for the last 3 years and has gotten nowhere because he hasn't had documentation. He paused. Until potentially now. Lena sat with that. The journalist publishes. The story gets characterized as unauthorized military medical experimentation. My name is in the file as the primary operator. And you are a civilian now, working as a nurse with no institutional protection, Reeves said. No active clearance, no command structure to push back. While you're in a hospital bed, she said. While I'm in a hospital bed, he confirmed without apology. She stood up. Not dramatically, just needed to not be sitting. Walked to the window, looked at the parking structure, the early morning sky going from gray to a pale, washed-out blue. She thought about the conference room upstairs, the people in it, Ferris saying they're not all from the same office with that specific hesitation. Ferris, she said. Upstairs, she's not hospital liaison. No, Reeves said. She's counter-program. She's tracking the file. She's been tracking Pruitt for 6 weeks, Reeves said. She doesn't have enough to move on him yet, but she knows what he has and she knows he's made contact with the journalist. He let a beat pass. She also knows that the moment that story runs, your ability to cooperate with any federal investigation becomes significantly more complicated. Because I'll be the subject of one, Lena said. Because you'll look like one, he said. There's a difference. But in practice it doesn't matter, she said. She turned away from the window. Her mind was running the problem the way it had been trained to run problems. Sequentially, prioritizing the immediate over the systemic, not because the systemic didn't matter, but because you couldn't fix anything you couldn't reach. Immediate problem. Pruitt had documentation. Documentation was potentially actionable. Actionable within a time window she didn't know. How long before the journalist runs it, she asked. Ferris thinks 2 weeks, maybe 3. He's been sitting on it waiting for one more source to confirm. And Pruitt is the source. Pruitt is the source, Reeves said. The journalist doesn't know that yet. He thinks Pruitt is a verification contact. Something clarified in her thinking. Pruitt is going to give him the documentation and make it look like it came from inside the program, from someone with access. Which technically he had, Reeves said. Which makes him unfindable as the leak, she said. He gets the story out. The story damages the program, damages me, and Pruitt walks away clean because he was just a logistics contractor who happened to be in the room. Reeves said nothing, which was confirmation. She sat back down. Not because she'd resolved anything, but because her body had decided it was done standing. Why did you route here? She said. Specifically. If Ferris has been running this for 6 weeks, if she knows about Pruitt, why did you need to come to me? He was quiet for long enough that she looked up at him. Because Ferris needs a witness, he said. Someone who was in Kestrel. Someone with direct knowledge of what those decisions actually were, the context, the conditions, the medical necessity. He held her gaze. And the 2 people with that knowledge who are still accessible are you and me. And you're going to be in a recovery room for at least 5 days, she said. And I'm going to be in a recovery room for at least 5 days, he agreed. She let the full weight of it settle, not panicking. She had learned a long time ago that panic was a form of inaction dressed up as urgency, and urgency without direction cost more than it bought. She let herself feel the full shape of the situation, the size of it, the places where it was solid and the places where it was not. And then she began methodically to think. I need to talk to Ferris, she said. Yes, Reeves said. Alone, not in that conference room. Agreed. And I need you to stop pulling out your IV line. He almost smiled. No promises. She stood up again, and this time she was going. At the door she stopped without turning around. The 3 people who requested my location, she said, in the last 18 months. Yes, he said. Was one of them you? A beat of silence. Go talk to Ferris, he said. She went. The 4th floor conference room had mostly cleared by the time she got back upstairs. Suen was gone, the legal counsel was gone, and the two chairs they'd occupied had been pushed back at angles that suggested a hasty departure. Bol was in the hallway outside, on his phone, and he looked up when he saw her coming and said something brief into the phone and ended the call. "He told you," Bol said. "Enough," she said. "Where's Ferris?" Bol tilted his head down the hallway. "Room 412. She's been on the phone since you went downstairs." Lena walked past him. Behind her, she heard him fall into step. Not following, just moving in the same direction, which she decided to allow. Room 412 was a small family consultation room, bland and neutral in the way those rooms were designed to be, with chairs arranged around a low table and a box of tissues on the windowsill that probably saw more use than anyone liked to think about. Ferris was standing at the window when Lena came in, phone in hand, and she turned with an expression that had shifted since the conference room. Less institutional, more operational. "Close the door," Ferris said. Lena closed it. Bol stayed outside. "You talked to Reeves," Ferris said. "Garrett Pruitt," Lena said. "That's where we're starting." Ferris absorbed the directness without reacting to it. "All right." "You've been tracking him for 6 weeks. What do you have?" "I have communication logs," Ferris said. "Contact between Pruitt and a journalist named David Selk, who covers national security for an independent outlet. 3 calls. 1 in-person meeting in D.C. 6 days ago." She set her phone on the table and sat down. "I have enough to know what Pruitt is doing. I don't have enough to prove he retained the documentation wrongfully, because the archival process for Kestrel was managed by people who are no longer in accessible positions, and the chain of custody record has—" She paused. "Gaps." "Convenient gaps," Lena said. "The kind that happen when someone plans for them," Ferris said. "Yes." Lena pulled out a chair and sat across from her. "What do you need from me?" "A first-person account of the medical decisions documented in your operational file," Ferris said. "Context, conditions, necessity. Submitted formally, under protection, before Selk publishes." "If I submit a formal account, I'm acknowledging the file exists." "The file exists whether you acknowledge it or not," Ferris said. "I'm acknowledging I know it exists," Lena said, "which has implications for why I was told it was sealed." Ferris held her gaze. "I know. And you're asking me to do it anyway." "I'm telling you that the alternative," Ferris said carefully, "is that the first public account of those decisions is Pruitt's framing through Selk's story, without your context, without any record of what was actually happening on the ground." She let that sit. "You know what those decisions were. You know what the conditions were. What you did in Kestrel saved lives under circumstances that nobody in that journalist's readership is going to understand unless someone explains it." "You want me to explain it," Lena said. "I want you to put it on record," Ferris said. "There's a difference." Lena looked at the box of tissues on the windowsill for a moment. It was a strange thing to focus on. She focused on it anyway because sometimes the ordinary things in a room were the only stable point. "I need 24 hours, she said. "You have 12, Ferris said. "Selk has a source meeting tomorrow morning. If Pruitt gives him the documentation at that meeting, the story goes to editorial review immediately and we lose the ability to contextualize before publication." 12 hours, Lena repeated. "I know it's not enough," Ferris said. "I'm working with what I have." It was an honest answer. Lena respected honest answers even when they were inconvenient. She stood up. "I need to talk to someone first," she said, "before I commit to anything." "Who?" "Someone who was there," Lena said, and she left it at that. The person she needed was not in the hospital. His name was Warren O'Keefe, and he had been the intelligence coordinator for Kestrel for the first 7 months of the program. The person who had sat in the forward operating post and translated field conditions into information that shaped every decision Lena made when she was on the ground. He was 46 now, retired from federal service, living in Northern Virginia with a mild social media presence and a second career teaching logistics at a small private college. She called him from the stairwell on her personal cell because she did not trust the hospital network for this conversation. He picked up on the second ring. "Vasquez," he said, and his voice had the same quality it always had, careful, precise, the voice of a man who had spent years listening to things other people missed. I was wondering when you'd call. You heard, she said. I heard Reeves was transported to your hospital last night, he said, which means either it was coincidence or he made a decision, and Reeves doesn't do coincidence. Pruitt, she said. A short silence. How much do you know? Enough to know I'm in a situation I didn't build, she said. I need to know if you have anything that speaks to chain of custody on the Kestrel archive. Another silence, longer this time. She could hear him moving. A chair, a door, the specific sound of someone going somewhere more private. I kept copies, he said. She closed her eyes for a half-second. Warren. I kept them because I didn't trust the archival process, he said. I know that's not... I know, but I had reasons. I know you had reasons, she said. I need to know if your copies show what actually went into the archive and when. They show everything, he said, including the version Pruitt submitted versus the version that was authorized. There are 17 discrepancies. She felt something shift in her chest. Not relief, because relief was too simple, but the specific sensation of a problem acquiring a shape you can work with. 17 documented instances where Pruitt's submitted version differs from the authorized record, Okiki said. The most significant ones are the ones involving your field decisions. He redacted the condition reports, the ones that established medical necessity. So the file Pruitt has shows decisions without context, she said, and your copies show the full record including the conditions that made those decisions necessary and authorized. Yes, Okiki said. Warren, she said, I need those copies. Today. He was quiet again, the particular quiet of someone doing a calculation that involved risk to themselves. She had not missed that. She was not going to pretend it away. You know what it means if I surface them, he said. I know, she said, and I'm asking anyway. If Pruitt finds out before Ferris can move on him, I know, she said again. I'm not... He stopped, started again. I'm not saying no, I'm saying I need you to understand what you're asking. I understand what I'm asking, she said quietly. I also understand that if Selk runs this story with Pruitt's version of the file, it doesn't just come after me, it comes after the people who were on the ground with me. It comes after the decisions that were made in conditions nobody in a newsroom is going to have context for. She let a beat pass. You were there. You know what those conditions were. I was there, he said. It came out differently than the same phrase would have sounded from anyone else. Weighted, specific, carrying something she recognized. Then help me, she said. He exhaled. I can be there in 4 hours. Give me an address that isn't the hospital. She gave him a coffee shop 2 blocks from the parking structure. She ended the call and stood in the stairwell for a moment, listening to the building around her. The floors above, the elevator running, someone on the next landing taking the stairs at a fast clip. The ordinary sounds of a hospital morning, continuing to happen regardless of what was occurring in stairwells and consultation rooms and recovery units. She went back to the floor. The next 3 hours were almost normal, which was its own kind of dissonance. She charted. She checked on a patient in Bay 4 who had been admitted overnight with a fractured wrist and high blood pressure and had strong opinions about the television programming. She restocked the cart she'd done at 3 in the morning because it needed doing again. Calloway passed her twice. The second time he stopped. Holt submitted his incident report, he said. I know, she said. I read the summary. He paused, and she could see him deciding something. He said the diagnostic call was accurate and timely, and that the outcome was directly attributable to it. He said that. He seemed mildly disbelieving about it. Holt is accurate when it matters, she said. That's not nothing. He also said there should be a formal review of how the call was handled in the room, the way it was received. He looked at her with the expression of someone piecing together something they'd been adjacent to and hadn't fully seen at the time. He didn't say it was his fault, but he didn't say it wasn't. That's about as close as he gets, Lena said. Calloway nodded slowly. He seemed to be in the middle of a longer internal reckoning that was going to take more than this conversation to resolve. She didn't push it. Some things had to be worked out in the person's own time, or not at all. At 10:15, her phone buzzed. Okiki. On my way. Earlier than I thought, 2 hours. At 10:47 a.m., everything changed. She was in the medication room when Sandra Park appeared in the doorway with an expression she had not seen on Park's face before. Tight, controlled, carrying something that wanted to be urgency but was being held at professional distance. "You need to come to the floor," Park said. "What's wrong?" "There's a man asking for you at the nursing station," Park said. "He's not a patient. He's not family. He identified himself as a journalist and he asked for you by name." Lena set down what she was holding. "What name did he use?" she said. "Vasquez," Park said. "But then he said he was actually looking for someone with a different name. A name I didn't recognize. Military sounding." Selk had her name. Both of them. She moved past Park into the hallway, and her mind was running fast and clean the way it did when circumstances stopped being theoretical. Not panicked, just accelerated, processing at the speed the situation required. Selk was here 12 hours before the source meeting Ferris had described, which meant either the timeline had moved or Pruitt had given him the documentation already, or there was a third variable she hadn't accounted for. She came around the corner to the nursing station, and she saw him immediately. Mid-40s, medium build, a canvas jacket with too many pockets, the look of someone who had been doing this long enough to not care about looking like he was doing it. He was talking to the unit coordinator, who was giving him the polite stonewalling of someone who had dealt with press inquiries before. He saw Lena at the same time she saw him. She knew from his expression that he recognized her. She didn't know from what. "Miss Vasquez," he said, I'm David Selk. I was hoping we could talk." "This isn't a good time," she said, keeping her voice at the register she used for difficult conversations on the floor. Level, professional, not inviting extension. "I understand. I can wait." He had the particular patience of someone who had learned that waiting was a tactic. "I have some questions about a federal program that I believe you have knowledge of. I want to give you the opportunity to provide context before I publish." The unit coordinator was pretending to look at her computer. 2 nurses near the supply shelf had gone very still. "You should speak to the hospital's media relations office," Lena said. "I don't have questions for the hospital," he said. "I have questions for you, about Kestrel." The name landed in the middle of the nursing station like something had been dropped on the floor. Lena did not react. She was good at not reacting. It was a trained thing, a deep thing, the kind of thing that had kept her functional in rooms where reacting cost more than it was worth. She held Selk's gaze and kept her voice exactly where it had been. "I don't know what that is," she said. "I think you do," he said. Not unkindly, in fact with a kind of professional regret, the regret of someone who would have preferred not to be having this conversation in a hospital hallway, but was going to have it anyway. "I have documentation that places you as the primary medical operator for a classified program that ran for 14 months. I have records of procedures performed outside standard protocol. I have—" "Stop," she said. He stopped. "You are in a clinical environment," she said, "and you are speaking to a member of this hospital's staff about matters that are, if they exist, classified under federal statute. This is not the appropriate venue for this conversation, and I strongly recommend you contact the appropriate federal channels before you publish anything." "I've contacted the appropriate federal channels," he said. "They haven't responded." "Then contact them again," she said. "Today." "My deadline is tomorrow morning," he said. She looked at him. He looked back. He was not a bad person. She could see that, the way she could usually see the basic nature of people when she had enough stillness to look. He was doing what he believed was a legitimate job, and he had been given documentation that told a particular story, and he had not yet been given any reason to doubt it. That was the problem. "I will speak to you," she said carefully, "at a time and place of my choosing, with appropriate representation present. Not here, not now." "I can give you until this evening," he said. "I'll be in touch," she said. He produced a card. She took it. He nodded once and walked back toward the elevator. She stood at the nursing station until the elevator closed. Then she pulled out her phone and called Ferris. "Selk is here," she said when Ferris picked up. "He's already got the documentation. The timeline is gone." A pause on Ferris's end. "How much does he know?" Enough to use the program name, Lena said. Enough to know my operational designation. She moved toward the stairwell, out of the floor's earshot. Okiki is 2 hours out. He has copies of the full archival record, including Pruitt's deviations. If you can get me a protected channel to submit a formal first-person account, I can have that ready in an hour, Ferris said. Then we have 1 hour to build a record that contradicts Pruitt's version before Selk goes to editorial. She stopped at the stairwell door. Can you move on Pruitt today? Another pause, longer. If Okiki's documentation shows what you're saying it shows, I can have a federal hold on Pruitt's materials by this afternoon. Ferris's voice had changed, less institutional, more direct. But Vasquez, if we move on Pruitt and it doesn't hold, if the documentation doesn't establish wrongful retention clearly enough, then the story runs and we're both in a worse position than we're in now, Lena said. I know. I need you to be certain about Okiki's copies. I am certain, Lena said. And she was. She had worked with Okiki for 7 months in conditions where certainty was the difference between functioning and not. And she trusted his assessment of his own documentation the way she trusted few things. All right, Ferris said. 1 hour. Lena ended the call. She pushed through the stairwell door and took the stairs up because the movement helped her think. And she was thinking hard, and what she was thinking was that in the next 2 hours she was going to have to do something she had spent 2 years carefully, deliberately, methodically avoiding. She was going to have to open the file herself. Not Pruitt's version, not Selk's version, hers. She was going to have to sit in front of Ferris and Okiki and whoever else needed to be in the room. And she was going to have to speak out loud about the 14 months she had not spoken about to anyone. The decisions, the conditions, the specific nights when the calls she made were the only calls available, and they were not clean, and they were not easy, and they had not always ended the way she needed them to. She had kept those months inside a locked room in herself for 2 years, and she had been very careful about the lock, and she had known in some part of herself that the lock was always temporary. She just hadn't known it would be a Tuesday morning in a hospital stairwell. On the landing between the 3rd and 4th floors, she stopped. Her phone buzzed. Not Ferris. Not Okiki. An unknown number. She almost didn't answer it. She answered it. Chief Vasquez, said a voice she didn't recognize. Male, calm, with the specific cadence of someone reading from a script they'd memorized rather than written. My name isn't important. What's important is that you understand something before you go any further with the conversation you're about to have. She said nothing, waiting. The file Okiki has, the voice said, the copies he kept. He's not the only one who knows about them. Her hand tightened on the phone. Pruitt has known about Okiki's copies for 3 months, the voice said, and the documentation Selk received this morning is not what you think it is. She made herself breathe evenly. What is it? It's a version, the voice said, a specific version, constructed specifically for Selk, designed to be contradicted by exactly the material Okiki has. A pause. Which means when Okiki surfaces his copies to Ferris to rebut Pruitt's version, Pruitt can claim Okiki's copies are the fabrication. She understood it a full second before the voice finished saying it. It's a trap, she said. It was always a trap, the voice said. The question is whether you can see who built it before you walk into it. And then the line went dead. She stood on the landing between floors, phone in hand, the stairwell completely silent around her, and she felt something she had not felt in a very long time. Not fear exactly, but the specific sensation of a situation that was larger than it had appeared from the outside, with more architecture than she had mapped, designed by someone who had planned for her to be exactly here, in exactly this position, making exactly this call. Somewhere above her, on the 4th floor, Ferris was setting up a protected channel. Somewhere on the road, Okiki was driving toward her with documentation that had been anticipated. And somewhere outside the building, a man named Garrett Pruitt, who she had never met, had been waiting for over a year for her to do precisely what she was about to do. She stood on that landing for exactly 90 seconds. She counted them, not because the count mattered, but because it was something concrete to do while her mind ran the problem from the beginning and tried to find the part she had missed. The part that had been there all along, visible, if she'd been standing at the right angle. Pruitt had known about Okiki's copies for 3 months, which meant Pruitt had built his strategy around the existence of those copies. had constructed Selk's version of the documentation specifically to be contradicted by them, had waited for the moment when Okiki surfaced his material to Ferris, at which point Pruitt would produce something, a timestamp, a metadata record, a chain of custody document, that made Okiki's copies look like the fabrication. The logic was clean. That was the thing that told her it was real. It was too clean to be improvised. Someone had thought about this for a long time. She ran it forward. If Okiki handed his copies to Ferris and Pruitt immediately challenged their authenticity, the federal hold Ferris had described would stall while the competing documentation was reviewed. That review process would take weeks. During those weeks, Selk would publish. The story would run with Pruitt's framing. And then, even if the review eventually vindicated Okiki's copies, the public record would exist, and the public record was harder to correct than a federal hold was to issue. Pruitt didn't need to win the documentation fight. He just needed it to be a fight long enough for the story to run. So she could not let Okiki hand over the copies. Not yet. Not until she understood what Pruitt was going to use to challenge them, which meant she needed to understand what Pruitt actually had. She called Okiki back. He picked up on the first ring. "I'm 40 minutes out," he said. "Don't bring the copies to the hospital," she said. A beat. "What happened?" "Someone called me. I don't know who. They said Pruitt knows about your material and he's set it up to be challenged when you surface it." Okiki was quiet for longer than she expected. "What kind of challenge?" "I don't know yet, but I need you to hold the copies until I do." She leaned against the stairwell wall, keeping her voice below the range that would carry. "Where's the original authorization documentation? The mission approval chain, not your copies, the authorized originals." "Those would be in the classified archive," Okiki said slowly. "The ones Pruitt was supposed to submit." "And did he submit the authorization chain?" Another silence. Longer this time. He stopped. "I assumed he did. That part was separate from the medical records. It was submitted by a different track." "Can you verify that from where you are?" "I can make a call," he said. "But if the authorization chain is in the archive, it's behind a clearance wall I don't have anymore." "Who does?" "Reeves," Okiki said. "Reeves still has an active clearance, or did, before last night." She was already moving back up the stairs. "Keep your copies secured and keep driving. Don't go to the coffee shop. Go to the address I'm about to text you." She pulled the stairwell door open with her shoulder. "And Warren, don't talk to anyone between here and there, including anyone who sounds like they're trying to help." She sent him the address of the hospital's family residence building 2 blocks north, where overflow patient families sometimes stayed. She had accessed it twice in 6 weeks for patient transport coordination, and she knew the ground floor had a conference space that wasn't scheduled on Tuesdays. Then she went back to recovery. Reeves was where she'd left him, which was to say propped higher than the bed was designed for, left arm immobilized, watching the door with the particular alertness of someone who had been trained to monitor entrances. He saw her face when she came in, and his expression adjusted. "Something happened," he said. "I got a call," she said. She gave it to him fast. The unknown number, the voice, the structure of what Pruitt had built. She watched his face as she talked. He didn't interrupt. He was good at that. Always had been. The ability to take information in without layering his own response over the top of it until he had the full shape. When she finished, he looked at the ceiling for a moment. "The authorization chain," he said. "If Pruitt didn't submit it, or if he submitted a modified version, then the archive doesn't have a clean record of what was actually sanctioned," Reeves said, "which means even the authorized medical decisions look unauthorized because there's no approval documentation attached to them." He shifted, winced. "That's not an accident." "No," she said. "He's been planning this for longer than 3 months," Reeves said. "The authorization chain would have been his first move, before he even started building the version for Selk." He looked at her. "I can get into the archive." "You're in a recovery bed." "I have clearance and a phone," he said. "Damon, Lena." He said it with a flat patience that she recognized, the voice he used when he was done arguing about something and was simply going to do it. I can make one call and get a clearance verification in 20 minutes. You don't have 20 minutes to spend convincing me not to. She looked at him. He looked back. Make the call, she said. She went back upstairs to find Ferris, and she told her about the unknown call in the stairwell without telling her about Reeves's call, because there was a version of this where Ferris's instinct would be to slow down and run verification, and that instinct was professionally correct, and also something they did not currently have time for. Ferris listened without expression. You don't know who called you, she said when Lena finished. No. Which means we don't know if the call itself is part of the setup, Ferris said. Lena had thought about this. We don't, she said, but the logic of the trap is sound regardless of who told me about it. Even if the call was designed to make me hesitate, the hesitation is correct. Unless hesitating is what Pruitt wants, Ferris said, then we have a problem either way, Lena said. So we move to the thing we can actually verify. Ferris absorbed that. The authorization chain. If Pruitt didn't submit it, there's a gap in the archive. That gap is verifiable independent of Okiki's copies. It doesn't require anyone to evaluate competing documentation. It just requires someone with current clearance to run an archive check and tell us what's there. That's a federal records request, Ferris said. Even with my credentials, it takes hours, Lena said. I know, I need it started now. Ferris looked at her for a moment, and Lena could see her doing the same kind of rapid triage she herself had been doing, cataloging what was possible, what was risky, what the cost of being wrong was in each direction. If I run this request and Pruitt has someone watching for archive queries, Ferris said, he'll know we're on to the authorization chain. If we don't run it and he doesn't, we lose the only clean verification we have, Lena said. You're asking me to take a risk on incomplete information. Yes, Lena said. A beat. Ferris picked up her phone. I'm going to need the specific program identifier and the date range of the authorization documents. Lena gave them to her from memory, because she had always had that kind of memory, the kind that retained the specific details of things that mattered, the dates and designations and authorization codes that formed the skeleton of the 14 months she had spent in a program that was now trying to eat her from inside. Ferris made the call. Lena went to find Bowl. He was at the nursing station on the 3rd floor, which she hadn't expected, talking with a quiet intensity to Sandra Park, who was showing him something on a monitor. They both looked up when Lena came around the corner. What is it? Lena said. Bowl turned the monitor toward her. It was security feed. The hospital's front entrance, time-stamped 40 minutes ago. A man in a gray jacket was walking across the lobby. The angle was partial, face not fully visible. One of my team flagged him, Bowl said. He's been in the building twice this morning, once before Selk arrived, once after Selk left. Lena looked at the build, the way the man moved, the specific angle of his shoulders when he turned toward the elevator. That's not Selk, she said. No, Bowl said. We ran the partial against known associates of Pruitt's. It's a match to a man named Victor Dre. He's a private security contractor Pruitt has used before. He's been in the building twice, Lena said. We think he was here to confirm you were on shift, Bowl said. To confirm Okiki wasn't here yet. To stage something. She looked at him. Stage what? We don't know, he said, with the particular honesty of someone who had been doing this long enough to know when they were behind. But he came in both times through the main entrance and left through the parking structure, Park said quietly. The parking structure is where the hospital's document processing room is. Medical records. Lena looked at her. Records. Physical records for patients admitted in the last 48 hours aren't fully digitized yet, Park said. The system has a processing lag. Anything from the last 12 hours is still in paper form in the processing room until the overnight clerk enters it. Reeves had been admitted 8 hours ago. Lena was moving before she'd finished the calculation. The document processing room was in the basement level of the parking structure, accessible from the hospital through a connecting corridor that most staff used maybe twice a year. It smelled of toner and recycled air, and the specific staleness of a room that did important work and received no natural light. 2 clerks worked it during the day. At 11 a.m. on a Tuesday, one of them was on break and the other was on the phone. The other was Dre. Not behind the desk, at the filing cabinet along the back wall, moving with the practiced efficiency of someone who had done this kind of thing before and was almost done. He had a folder in his hand. He was photographing its contents with a phone held flat and steady. He heard her come in and turned fast. She was already across half the room. "Put it down," she said. He assessed her in the way people who had been trained to assess people did. Fast, complete, arriving at a conclusion. His conclusion was wrong. She could see it in the half-second he spent deciding he could manage this. He moved toward the door. She was faster, and she was not gentle about it, and the folder hit the floor and Dre hit the wall, and she had his phone in one hand and his collar in the other before he had finished processing what had happened. "Who sent you?" she said. He said nothing. She applied pressure to the specific point at the base of his wrist that made further silence anatomically difficult to maintain. He made a sound. "Who sent you?" she said again. "Pruitt," he said. "Pruitt, stop." She let him go, stepped back, picked up the folder. It was Reeves' admission paperwork, the intake form, the initial assessment, the surgical consent. Nothing classified, nothing operational. But the photographs would document Reeves' presence here, his admission date, his physical condition. Documentation of a military commander's whereabouts in a civilian hospital. She understood why immediately. If Pruitt could show that Reeves had specifically routed his transport here, had chosen this hospital, this location, this nurse, it corroborated the connection between them. It made their relationship look operational rather than historical. It made her look like she was still active, still part of a network, rather than what she was, which was a civilian trying to stay that way. She put the folder back in the cabinet. She held on to the phone. Bowl appeared in the doorway 40 seconds later, and he took one look at Dre against the wall and the folder in the cabinet and the phone in Lena's hand and called for backup without being asked. The next 2 hours had the quality of things moving faster than anyone had planned for. Dre was taken to a secure room on the 4th floor that was not technically a secure room, but became one when Bowles' team occupied it. He was not cooperative, and then he was, in the way that people sometimes became cooperative when they understood the specific nature of what they'd been caught doing and realized the person who'd caught them had witnesses. Pruitt's phone number was in Dre's call log. 3 calls in the last 4 hours. The most recent was 11 minutes ago, just before Dre had gone to the records room, which suggested the photography had been Pruitt's instruction given in real time, which meant Pruitt was close. Ferris got the archive query result at 12:47 p.m. She came to find Lena in the corridor outside recovery, and her expression was the expression of someone who had confirmed something they had suspected but had not wanted to be right about. "The authorization chain is incomplete," she said. Lena waited. 3 documents are missing from the archive, Ferris said. The mission approval for months 9 through 11, the medical protocol extension for the last quarter of the program, and she paused. The commanding officer's endorsement of field medical decisions for the full operational period. Those are the documents that would have established that everything I did was sanctioned, Lena said. Yes, Ferris said. Without them, the archive shows medical procedures with no command authorization attached. Yes. And Pruitt controlled the submission of those specific documents. His signature is on the archival receipt, Ferris said. He checked those documents in, but they're not there. It landed cleanly. Not with surprise, the logic had been pointing here, but with the specific weight of a thing you'd understood theoretically becoming something you could hold. Pruitt hadn't modified the documents. He'd removed them. 3 targeted absences that turned a sanctioned program into something that looked, to anyone reading the archive without context, like unsupervised experimentation. That's federal records tampering, Lena said. Multiple counts, Ferris said. And now that we have the archive gap documented on record, with timestamp and his signature on the receipt, the documentation he gave Selk looks exactly like what it is. A story built on a deliberately incomplete official record. Can you move on him now? Lena said. I need one more thing, Ferris said. I need Okiki's copies to show the missing documents existed, to show what was in those 3 files before Pruitt removed them. He's here, Lena said. She'd gotten his text 20 minutes ago. He's in the family residence building. But Ferris, if Pruitt knows about the copies, Pruitt is about to have a more immediate problem, Ferris said, and her voice had acquired a particular quality. Dre made 4 calls this morning, 3 to Pruitt, 1 to a number that traced to a prepaid, but the cell tower data puts Pruitt's phone in Calverton. She looked at Lena. He's here. Not close. Here. In this building or within a block of it. Lena looked down the corridor. He came to watch, she said. Or to run something directly if Dre failed, Ferris said. The thing about a plan built over a year was that it required the person who built it to be confident in its architecture, confident enough to be present for the execution, close enough to manage variables in real time. Pruitt had been managing Dre by phone from somewhere nearby, which meant he had come to Calverton to see this through personally, and now Dre was in a room on the 4th floor, and the archive query had run, and the plan was developing cracks visible from a distance. Lena said, Pull Okiki in. Get the copies in front of you now, before Pruitt knows the archive query is complete. Ferris was already on her phone. Okiki arrived at the hospital's east entrance 18 minutes later, and Lena met him in the corridor because she needed to see his face before he went into the room with Ferris, and the weight of what she was about to ask him to do landed differently when she could see that he had thought about it and decided. He was older than she remembered. He always was. It surprised her each time, the way people aged in the gaps between the moments you shared. He had gray at his temples now, and the way he held himself was slightly more careful than it used to be, like someone who had learned to budget their energy. He handed her a hard drive without being asked. Everything's on here, he said. Full copies. Original metadata intact. The files haven't been opened since I made the copies in 2022. Pruitt may have a way to challenge the timestamps, she said. He can try, Okiki said. I used an air-gapped system and I've kept it disconnected since. The metadata hasn't degraded. He paused. But Lena, the missing authorization documents. If those 3 files are gone from the archive and I have them here, then the copies become the only existing record of their content, she said. Which is either the most valuable thing in the room, he said, or the thing Pruitt uses to claim I fabricated them. The archive gap is already documented, she said. His signature on the receipt is already on record. The copies aren't the primary evidence anymore. They're corroboration. She held his gaze. You did the right thing keeping them. He looked at her for a moment. I kept them because I knew something like this was possible, he said. I didn't know it would take this long to happen. Let's make sure it finishes today, she said. They went up together. The next hour in room 412 was the kind of hour that didn't feel like an hour from the inside. Compressed and dense, each minute carrying more load than minutes normally carried. Ferris and Okiki worked through the copies methodically, cross-referencing against the archive gap documentation, building a record that was not dependent on any single piece of evidence, but on the accumulating weight of multiple independent sources all pointing to the same thing. Lena sat at the far end of the table and gave her account. She had thought it would be harder. In some ways, it was harder than she had anticipated. Not the facts, which she delivered precisely, but the texture around the facts, the conditions, the specific nights when the decisions had been made in heat and darkness and urgency, and she had not known at the time how they would look from a conference room in a hospital 4 years later. She said all of it. She did not make it cleaner than it was. She did not dress it up or contextualize it beyond what was accurate. She said, these are the decisions I made, and these are the conditions under which I made them, and this is the authorization I had, and these are the outcomes. It took 40 minutes. At the end of it, Ferris looked at Okiki and Okiki looked at Ferris, and whatever passed between them in that look was the look of 2 people who had just watched something become more solid than they had expected. This is sufficient, Ferris said. Not warmly. She wasn't a warm person in professional mode, but with the weight of a real statement. This is more than sufficient. Bull came in while Ferris was still organizing the documentation, and he came in fast enough that everyone at the table looked up. Pruitt's in the building, he said, not a block away. In the building. Where? Ferris said. 3rd floor. He came in through the parking structure entrance. He's at the nursing station asking for Lena Vasquez. The room processed that for a second. Pruitt was not hiding anymore. He had come here, personally, and he was asking for her by name at a hospital nursing station, which meant one of 2 things. Either he didn't know yet that the archive query had run and the copies were already in front of Ferris, or he knew everything and had decided to move directly regardless. Neither option was comfortable. "He's accelerating," Okiki said quietly. "If Dre told him something before you took his phone, Dre called Pruitt right before he went to records," Lena said, "which means Pruitt knows Dre was caught." "And he came anyway," Bowles said. "Because he thinks he still has the leverage," Ferris said. Everyone in the room understood what that meant. Pruitt had something they hadn't accounted for, something he was confident enough in to walk into a building where his contractor was already in custody and ask for the person who was building a federal case against him. Lena stood up. "I'll go," she said. "Absolutely not," Bowles said. "He came here for me," she said. "He's not going to tell anyone else what he thinks he has. He's going to tell me." Ferris was quiet for a moment, her eyes moving through some calculation. "If he says something actionable, I know," Lena said. She went downstairs. Pruitt was at the nursing station, and he looked exactly like what he was. A logistics man, mid-50s, the kind of build that had once been functional and had softened at the edges, with the particular self-possession of someone who had spent a career operating just outside the frame of accountability. He was not imposing. He did not look dangerous. He looked at her the way a man looks at a chess piece he's been moving for a long time. "Ms. Vasquez," he said. "Mr. Pruitt," she said. The recognition on his face, that she knew his name, that she said it without hesitation, was brief but visible. "I think we should talk," he said. "We are talking," she said. Sandra Park had gone very still at the nursing station, the kind of still that was professional and also attentive. And Lena was grateful for it without showing it. "I want to be straightforward with you," Pruitt said. "I have nothing against you personally. I have documentation that certain decisions were made during a federal program without proper authorization, and my obligation—" "Your obligation to whom?" she said. He paused. "To the public interest." "You removed 3 authorization documents from the Federal Archive," she said. "Your signature is on the receipt. The archive gap was documented 20 minutes ago." Something moved in his face. Not panic. He was too controlled for panic, but the specific recalibration of someone who has found out they are further behind than they thought. "Whatever you think you've found, we found the gap," she said. "We have Okiki's copies of the missing documents. We have your call logs with Dre. We have Dre." She let each item land before continuing. "The federal records tampering charge alone carries 5 to 7 years. The contractor you hired is currently explaining that in some detail upstairs." Pruitt was very still. "Here's what I want to know," Lena said. "The call I got this morning. The unknown number that told me the copies were anticipated." She watched him. "That was you." He said nothing. "You told me it was a trap," she said. "You wanted me to hesitate, to not give Okiki's copies to Ferris right away, to slow down while you pushed Selk to move faster." She kept her voice at the same register. Not angry, not triumphant, just exact. "It almost worked. I stood in that stairwell for 90 seconds deciding whether to trust what you'd told me." Still nothing from him. "The problem," she said, "is that the trap worked in the wrong direction, because the hesitation made me look at the authorization chain instead of going straight to Okiki's copies. And the authorization chain is where your name is." Something collapsed in his expression. Not dramatically, just a settling, a loss of the particular tension that had been holding his face in a shape of confidence. "The documents I removed were," he started. "Don't," she said. "Don't do it in a hospital hallway. You have the right to counsel, and I strongly recommend you use it." Bowles appeared at the end of the corridor, moving at a pace that was not quite fast but was not casual. Pruitt looked at him, looked at Lena. And in the moment before Bowles reached them, he said something that she hadn't expected, quietly, without strategy, in the voice of a man who had stopped performing. "The program should have been shut down in month 9, he said. "What you were doing out there, but the decisions you were making, they never should have been authorized." "Then you should have raised that through the appropriate channels in month 9, she said. "I did," he said. Nothing happened. She looked at him. The honest part of her, The part that was not strategy and not vindication and not the clean resolution of a conflict, registered that he believed what he'd just said, that the original motive buried under everything that had come after it had been something he had genuinely believed. Then you should have kept raising it, she said, not built a file to use as leverage. Bol was there, and the conversation was over, and Pruitt's expression went back to controlled as he understood what the next several hours of his life were going to look like. What Lena had not expected, had not had room to anticipate in the compressed and complicated machinery of the morning, was David Selk. He was in the corridor. He had been in the corridor for some portion of the last exchange, she didn't know how long, standing near the wall with his notebook in his hand and an expression she could not immediately read. She looked at him. He looked at Pruitt, being moved down the corridor by Bol and a second agent who had appeared from somewhere. Then he looked at her. "The documentation he gave me," Selk said. "Not a question, not yet." "Is incomplete," she said, deliberately. "The missing pieces are upstairs." He was quiet for a moment, looking at his notebook. "He told me he was a whistleblower," he said. "I know," she said. "He had documentation," Selk said. "It looked credible," she said. "I know. It was designed to." He looked up at her. The journalist's expression, the one that was trained to receive information without broadcasting reaction, had slipped slightly, enough to show something that was not quite guilt but was adjacent to it. The expression of someone who had almost done a thing that could not have been undone. "I want to see the full record," he said. She looked at him for a long moment. "Talk to Agent Ferris," she said. "4th floor, room 412. She turned and walked toward the elevator. In the elevator, going up, she became aware for the first time in several hours that she was still in her nursing scrubs, still wearing her shift badge with the photograph that made her look like she'd been startled, still carrying the institutional smell of a hospital floor that had been her whole world 6 weeks ago and now felt like something she'd have to renegotiate. The elevator opened on the 4th floor. Ferris was in the corridor, phone in hand, and she looked at Lena with the expression of someone who had just received information that changed the arithmetic. "Pruitt's in custody," Lena said. "I know," Ferris said. Bol called. She paused. "There's something else." Lena waited. "The congressional staffer," Ferris said. "The one Pruitt was in contact with. Defense Oversight Committee." She held Lena's gaze. "We ran the communications. Pruitt wasn't giving her information about the program. He was asking her to request an investigation, a public one, that would have triggered a congressional hearing." Lena understood it immediately. "A hearing where I would have had to testify publicly," she said, "without protection, without the sealed status of the program. A hearing that would have put your operational file into the public congressional record," Ferris said, "where it would have been immune from the classification protections." The full architecture of it assembled itself in the space of 3 seconds, and it was larger than she had thought, more patient, more precisely aimed, not just the story through Selk, not just the documentation gap, but a route to a congressional record that would have been untouchable. "He wasn't trying to expose the program," she said. "No," Ferris said. "He was trying to expose me." "Specifically," Ferris said, "not the program, not the decisions. You, by name, on the public record." She stood in the corridor and let that be what it was. "Why?" she said. Ferris was quiet for a moment, in the way that suggested the answer existed and was complicated. "We're still working on that," she said. "But Pruitt's file has your name flagged dating back to 2020, before Kestrel ended, before you even transitioned out, before she'd done anything that could be characterized as a threat to him. Which meant the motive wasn't about the program's exposure at all, which meant there was something else, something she didn't know about yet, that had put her name in Pruitt's file 2 years before any of this had started." She looked at Ferris. "I need to talk to Reeves," she said. Reeves was awake, and he had pulled out his IV again. She stood in the recovery room doorway and looked at the disconnected line and the small bloom of dried blood at the insertion site and felt something that was too tired to be exasperation but was in the same neighborhood. "I'm going to start taping that to your arm," she said. "I needed to move around," he said. It was pulling. It was keeping you from getting an infection." She crossed to the bed, pulled on a glove from the box on the wall, examined the site. Not infected, not yet. She pressed a clean square of gauze over it and held it there with more pressure than was strictly medically necessary. Pruitt's in custody. I heard, he said. Bull texted. There's something else. She kept her voice even, kept her eyes on the gauze, because looking at him directly for this part felt like it would make it harder to say clearly. Ferris ran the communications. Pruitt's file has my name in it from 2020, before I transitioned out, before I did anything that should have been on his radar. Reeves said nothing. Damon, she said. I know, he said. She looked up. He was watching her with the expression of a man who had been waiting for a specific conversation to arrive and had not enjoyed the waiting. How long have you known? She said. Since March, he said. Last year. One of Ferris's people flagged Pruitt's activity and ran a background on why your name was in his file. He held her gaze, and to his credit, he did not look away. Pruitt worked logistics for a different program in 2019, before Kestrel, a program that overlapped, administratively, with a contract review that assessed which medical personnel would be assigned to Kestrel. She understood the structure of it before he finished. He controlled the assignment process, she said. Partially, Reeves said. He made recommendations. The final decisions were above his level, but his recommendations carried weight. A beat. He recommended against your assignment, twice. Both recommendations were overruled. Why did he recommend against me? That part took us longer to establish, Reeves said. The short version is that Pruitt had a preferred candidate, someone he had a prior working relationship with, a medical operator who would have been easier for him to manage because they had less experience and more debt to him professionally. And I was assigned instead, she said. And you were assigned instead, he said. And you operated for 14 months in a way that left no room for him to manage anything because you were good enough that nobody needed to manage you. Which meant Pruitt spent 14 months being irrelevant in a program he had expected to control. She absorbed that. The shape of it was smaller than she had expected. Not a vast conspiracy, not a calculated plan to destroy her built on principle or ideology. Just a man whose ego had been injured by an organizational decision made in 2019, who had spent years converting that injury into architecture. He targeted me because I got the job he wanted his person to have, she said. And because you were better at it than his person would have been, Reeves said, which made it worse. She removed the gauze. The site had stopped bleeding. She taped a clean dressing over it with more care than she'd intended to take. You should have told me in March, she said. I know, he said. I had a right to know. I know that too, he said, not defensively. I was trying to build enough of a case to move on Pruitt before he knew we were looking. If you'd known and changed your behavior, even slightly, he might have accelerated, gone to Selk earlier, gone to the staffer earlier. We needed him to feel like the plan was still intact. You used me as bait, she said, flat, factual. I used the situation as bait, he said. He stopped. No, you're right. The distinction doesn't actually matter from where you're standing. She stood at the side of the bed for a moment, not speaking. The monitors beeped their steady rhythm. Through the narrow window, the afternoon was going gray, clouds pulling in from the west with the particular weight of rain that wasn't there yet, but was coming. Is that why you routed here? She said, not just to warn me, to make sure I was in position when Pruitt moved. He was quiet long enough that it was its own answer. She had known Damon Reeves for a long time. She knew the texture of his silences, which ones were thinking, which ones were managing, which ones were the specific quiet of a person who had made a decision they weren't proud of and were not going to compound it with a bad explanation. This was the last kind. I also came because I needed someone I trusted, he said. Both things were true. But one of them was strategy, she said. Yes, he said. She nodded once, put the unused gauze back in the box, pulled off the glove. Reattach your IV, she said. I'll send someone in. She went to the door. Lena, he said. She stopped, hand on the frame. Everything I said about trusting you, he said. That wasn't strategy. That's been true since the first time I watched you work. She stood there for a moment. She thought about saying something and decided against it. Not because there was nothing to say, but because some things needed time before they became words, and this was one of them. She went back to the floor. The afternoon shift was coming on, and the transition had the particular organized energy of handoffs, briefings, chart transfers, the exchange of information between people going home and people arriving. Lena gave her handoff to the incoming nurse, a woman named Torres, who was competent and asked good questions, and stood at the nursing station doing the last of her chart entries for the day. Sandra Park stopped beside her on her way out. "You're still here," she said. "Finishing notes," Lena said. Park looked at her for a moment in the way she sometimes did, not intrusively, just attentively, the way a person looks at someone they've been paying quiet attention to. "You doing all right?" "I'll be fine," Lena said. "That's not what I asked," Park said. Lena looked up from the chart. Park was already moving toward the exit, coat over her arm, not waiting for a better answer, which was exactly the right call. Lena finished her notes. At 4:15 p.m., Ferris found her in the break room with a cup of coffee she hadn't drunk and a chair she had been sitting in for 11 minutes, doing very little. "Federal hold is confirmed on Pruitt's materials," Ferris said, sitting across from her without asking. His attorney was contacted at 2 p.m. The congressional staffer has been notified of the federal investigation and has suspended the hearing request pending review. She set a folder on the table between them. The archive gap is officially documented. Okiki's copies have been received into evidence. The discrepancies between Pruitt's submitted version and the authorized record have been formally noted in the investigation file. Lena looked at the folder without opening it. "Selk pulled his story," Ferris said. "He called his editor at 1:30. He's requested access to the full authorized record through proper channels before he publishes anything." "He'll publish eventually," Lena said. "Probably," Ferris said, "but it'll be the real story." Lena turned the folder around and opened it. The first page was a document she recognized. The format of a formal record correction, the kind issued when an incomplete or inaccurate entry in a federal system was officially amended. Her name was at the top. Below it, a list of the 3 restored authorization documents, now re-entered into the Kestrel archive with their original content intact. "It's not expungement," Ferris said. "The file still exists. The program is still classified, but the record is complete now. Anyone who accesses it sees the full context." "The decisions I made," Lena said, "they're authorized." "They always were," Ferris said. "Now the archive says so." Lena closed the folder. Outside the break room window, the first rain was starting. Light, tentative, the kind that took a while to commit. "What happens to Pruitt?" she said. "Federal charges for records tampering," Ferris said. "Minimum 3 counts. Potentially more depending on what comes out of the review of the authorization chain for the other programs he handled." She paused. "He's not going to have a quiet retirement." "What about the contractor, Dre?" "Cooperating," Ferris said, with the tone of someone who found this unsurprising. "He's been in this business long enough to know what cooperation buys." "And the staffer?" "Under review," Ferris said. "She may have been a willing participant, or she may have been genuinely deceived about Pruitt's standing. That'll take longer to establish." Lena nodded. The coffee was cold. She drank some of it anyway. "There's going to be a formal review of your background and credentials," Ferris said. "Hospital level, to close out the administrative question from this morning. Swen knows the broad outlines of what happened today. She's not going to create problems." A pause. "She seemed more interested in understanding how your military background could be formally incorporated into your role here." Lena looked up. "What does that mean?" "It means the chief of medicine of this hospital watched you call a hematoma from 6 feet away and save a SEAL commander's arm," Ferris said, with something that was almost dry enough to be humor. "She has opinions about that." The break room door opened. Calloway was standing there with the expression of someone who had started to knock and then hadn't. He saw Ferris. He looked at Lena. "Sorry," he said. "I can come back." "It's fine," Lena said. "We're done." Ferris stood, picked up the folder, and set it in front of Lena. "That's your copy," she said. "Keep it somewhere dry." She left. Calloway watched her go and then stood in the doorway for a moment, working out whether to come in or not. "Come in," Lena said. He came in, sat in the chair Ferris had vacated, put his hands on the table in front of him in the specific way people do when they are about to say something they have been practicing and are not sure they have right yet. "I owe you an apology," he said. You don't have to, No, I do, he said. What I said in the trauma room. When you were trying to, I told you to go find someone a warm blanket. He said it with a flat disgust that was directed entirely at himself. You were trying to tell Holt something that was going to save that man's arm, and I told you to go find a blanket. You didn't know, she said. That's exactly the problem, he said. It didn't matter what I knew or didn't know. You were saying something specific and considered, and I shut it down because of the tag on your badge. He looked at her directly, with the particular honesty of someone who has decided to stop managing their own discomfort. I've been thinking about it all day. Every time I've done that, assumed the floor staff had nothing to contribute, assumed the hierarchy meant something about the quality of the thinking. Every time. I've been doing it since my second week as a resident, and nobody ever made me look at it before. Lena looked at him. He was not performing this. That was the thing she could see clearly. He wasn't apologizing to feel better or to rebuild a professional relationship. He was apologizing because something had shifted in him, and he was honest enough to say it out loud even when it was uncomfortable. Learn from it, she said. That's all. I am, he said. I will. He paused. Holt wants to talk to you too. I don't know if that's... He said when you have time. I'll find him, she said. Calloway nodded, got up. At the door he stopped. The military technique you used, the tourniquet assessment, is that something you could teach? She looked at him for a moment. Yes, she said. I'd like to learn it, he said. Not as a transaction, not as a way of getting something, just as a statement of what he wanted. Then I'll teach you, she said. He left. She sat alone in the break room as the rain came on properly outside, heavier now, running down the window in lines that caught the last of the afternoon light. She thought about Reeves, upstairs with his reattached IV and his reattached ego, and the complicated true thing he'd said before she left. She thought about Okiki, who had kept copies for 4 years because he had trusted his instincts even when there was no immediate reason to act on them. She thought about Park, who had asked if she was all right and not waited for the answer, which was its own kind of care. She thought about the 14 months she had spent in Kestrel, not cleanly, not with the simplified narrative that would have made it easier to file away. She thought about it the way it actually was, difficult and necessary and imperfect and sometimes wrong and sometimes the most right she had ever been in her life. All of it tangled together in a way that resisted the kind of verdict that made people comfortable. She had not been a hero during Kestrel. She had been a person doing an extremely hard job with incomplete information, making the best decisions she could under conditions that would have broken a lot of people. And some of those decisions had been brilliant, and some had been costly, and one had gotten her closest friend killed on a road outside a city she still couldn't name out loud. She had left because she couldn't carry that and keep functioning, and leaving had been the right decision and also a permanent loss. And both of those things were true at the same time. She had come here, to this hospital, to these supply carts, to the name badge that said only Lena, because she had needed to be ordinary for a while, had needed to be the person nobody noticed, doing the work that kept things running, invisible in the comfortable way that doesn't cost anything. What she had learned this week, in a way she hadn't fully understood before, was that ordinary had never actually been available to her, not because of rank or reputation or anything as clean as that, because the knowledge was in her body, in her hands, in her eyes, in the specific way her mind ran when something was wrong, and she was the one who could see it. You could change the clothes, you could change the badge, you could change the city and the job title and the entire architecture of a daily life. The knowledge stayed. And the knowledge, it turned out, was not something to be ashamed of or hidden or kept behind a supply cart where nobody had to think about what it meant. It was something that had cost her enormously and had been earned in conditions she wouldn't wish on anyone, and it had, yesterday, at 11:53 p.m. in a trauma bay in Calverton, Virginia, saved a man's arm. That was not nothing. It had never been nothing. Dr. Marcus Holt found her before she found him, in the corridor outside the break room at 5 p.m., still in his civilian clothes, which meant he had come back to the hospital after the end of his shift, which meant this conversation was something he had decided was worth coming back for. He looked like a man who had been revising something in his head all day and had finally landed on the version he could live with. Walk with me? he said. They walked. The corridor, the elevator, down to the lobby, where the rain was audible against the glass entrance doors, and a few people sat in the plastic chairs with the stunned patience of people waiting for something they couldn't control. They stopped near the window. "I submitted my incident report this morning," Holt said. "You know that." "I know," she said. "What you don't know is that I submitted an addendum at 3 p.m. He looked at the rain on the glass. "The addendum documents the exact sequence. Your assessment, my dismissal of it, the delay, the ultrasound, the outcome, everything." He paused. "I also documented the environment in which you made that call, the way it was received, what was said to you." She looked at him. "I am not a person who finds this easy," he said, with the directness of someone delivering an honest self-assessment. "I was built by a system that rewards certainty and penalizes the appearance of doubt, and in 30 years I have absorbed that system to a degree that isn't always—" He stopped. "What I'm saying is that the addendum exists. It's in the file. It says what happened." "Thank you," she said. "I'm not looking for—" He started. "I know," she said. "Thank you anyway." He nodded. He looked like he might say something else and decided against it, and she respected that, the restraint of not filling silence with more words than the moment required. He left. She stood at the window and watched the rain for a while. The thing about being dismissed, really dismissed, in the bone-deep way, the way that accumulates over days and weeks and small moments, the "you don't belong here" of it, the "bring the supplies and stay out of the way" of it. The thing she had learned was that it didn't make you small. It made you feel small, which was different. The smallness was something done to you, not something you were. She had walked into this hospital 6 weeks ago, carrying 14 months of war and 4 years of grief, and the specific weight of a life that had cost more than she'd budgeted for. And she had done it quietly, and the people here had looked at the outside of that and seen someone to manage. Had seen the tag on her badge and the newness of her face, and had arranged her accordingly. What she had never stopped being, in the supply room and the break room and the long, quiet hours of the night shift, was the person who could see what others missed. The person whose hands didn't shake. The person who had learned the most important things about keeping people alive in places where the alternative was immediate and the margin was thin. That person had not been created by the recognition, had not required the salute or the archive correction or Holt's addendum to exist, had existed before any of them and would have continued existing without them. That was the thing she wanted to hold on to. Not the vindication, though the vindication was real and she was not going to pretend it wasn't, but the understanding that she had been what she was, even when nobody knew. Even when the room was laughing, even when she was handing someone a warm blanket because that was what the environment permitted. The knowledge doesn't disappear because nobody sees it. That's the hard part. That's also the part worth knowing. She took the elevator back to the 3rd floor. At the nursing station, Torres was managing the evening handoff with the competent efficiency of someone who didn't need oversight. Lena signed off on the last 2 items on her chart log, clipped the tablet back to its dock, took off her ID badge, and put it in her pocket. She went to the locker room, changed her shoes, sat on the bench for a moment. Then she went back upstairs. Reeves was sitting up properly this time, IV properly attached, left arm in a sling, color distinctly better than the last 3 times she'd seen him. He was looking at his phone, which he put face down when she came in the way of someone who had been doing something they'd rather not discuss, but wasn't going to lie about. "You were calling people," she said. "I was making arrangements," he said. "For what?" "For the formal after-action review of Kestrel," he said. "Now that the archive is complete. It needs to happen. Proper documentation of the program's outcomes, the medical decisions, the conditions. Not Pruitt's version, not mine. An actual review." "When?" she said. 6 weeks, he said. "They want you present, as the primary medical record." She sat in the chair beside the bed. The same chair, the same position. The same rain outside the window that had been there when this conversation started hours ago, now dark beyond the glass. 6 weeks, she said. "It'll be in D.C., he said. 2 days, maybe 3. After that," he paused. "After that, the record is closed, properly. The archive is complete and sealed, and nobody touches it." And me? She said. You go back to whatever you decide you're doing, he said. Nobody is going to come after you, Lena. After today, anyone who wanted to would have to go through a federal investigation file that now has your name on the right side of it. She looked at her hands for a moment. She had an athlete's relationship with her hands, aware of them, dependent on them in a specific technical way, attentive to their condition. They looked like what they were, the hands of someone who had done hard work for a long time. Suen wants to talk to me about my role here, she said. I heard, Reeves said. I don't know what I want that to look like, she said. You don't have to know tonight, he said. No, she said. I don't. She stood up. He looked at her with the expression she had come to recognize over the years as his version of something that wasn't easy for him. The expression of Damon Reeves when he was about to say something that cost him. I should have told you in March, he said. Yes, she said. I made a calculation, he said. It was the wrong one. Yes, she said again. I'm sorry, he said. Not elaborated, not cushioned, just the two words delivered in the voice of a man who meant them. She stood there for a moment. Get some sleep, she said, and leave the IV alone. She went home. It was the first time since early that morning that she had been somewhere quiet, and the quiet was strange at first. Too much room for the day to expand into, too many surfaces for it to bounce off. She made tea she didn't drink. She sat on her couch. She looked at the folder Ferris had given her, which she had brought home in her bag, and she opened it again and read through the record correction document more carefully than she had in the break room. Her name, correctly placed in a correct record. The authorization documents restored. The gap closed. It was not everything. It was a document. Documents were not the same as the dead, were not the same as the years spent making herself small in a building full of people who looked at her and saw a name badge, were not the same as the specific weight of carrying something important in a context that had no mechanism for recognizing it. But they were not nothing. She thought about what it meant, not in the large philosophical sense, but in the practical and human sense, to be seen accurately, to have the record corrected, to stand in a room where you had been dismissed and have the room discover that the dismissal was wrong. She had watched that happen today, in real time, in the faces of people who had made assumptions they had not examined, and what she had felt watching it was not the satisfaction she might have anticipated. It was more complicated than satisfaction. It was the recognition that being right had never been the point, that the knowledge had existed regardless, that the supply carts and the early shifts and the quiet 6 weeks of her ordinary borrowed life had been real and had mattered in ways that had nothing to do with being proven right to anyone. The work was the work. The knowledge was the knowledge. The rest, the recognition, the correction, the record, those were consequences of something that had already existed before anyone confirmed it. She put the folder on the table. Outside, the rain had stopped. The city was the particular clean quiet of a wet night after the weather has passed. Streets reflecting light they hadn't reflected an hour ago, everything washed to its real color. She thought about Calloway, who had asked to learn. She thought about Park, who had asked if she was all right and meant it. She thought about Okiki, driving home somewhere on the highway with 4 years of careful silence finally given permission to end. She thought about the man on the gurney who had raised his hand and changed everything, and she thought about whether she had needed him to, whether the truth of what she was had required his recognition to be true. It hadn't. That was the answer she kept arriving at. She had been what she was in every room she had ever stood in. The rooms that didn't see it weren't evidence against her. They were evidence of their own limits. The lesson, if there was one, was simpler than it looked. You don't become less of what you are because someone fails to see it. You just have to be willing to keep being it in rooms that aren't ready. You have to be willing to say the thing clearly, even when the room is laughing, even when someone tells you to go find a blanket. You have to trust what you know in the same way you trust your own hands. Not because anyone confirmed it, but because you learned it in places where being wrong was not something you survived. She had survived. She was still here. Tomorrow she would go back to the hospital and she would have a conversation with Dr. Patricia Suen about what her role there could look like, going forward, and she didn't know yet what shape that would take, but she knew it would not involve staying near the supply cart. She would check on Reeves and reattach his IV if necessary, and tell him things were even between them, which they mostly were. She would find Calloway and begin teaching him the tourniquet assessment in the specific methodical way that made knowledge transferable rather than just impressive, because the point of knowing something useful is that other people can learn it. She would do those things because they were the work. Because the work had always been the only point, not the recognition of it, not the correction of the record, not the public accounting of who had been wrong about what. The work was the thing, the knowing how to do it, the willingness to do it in a room that wasn't ready, the refusal to become small just because the environment made smallness convenient. Lena Vasquez had never been small. She had only ever been in rooms that needed to grow.